Hi, my name is Ravi Chandra, co-founder and CEO of Medpay. I come from healthcare experience. I've been in this industry for more than 12 years. So I've been a serial entrepreneur in healthcare, built two healthcare startups in the past. So I closely work with doctors, patients and insurers. So coming from this space, so I see a lot of potential opportunities as well as challenges in healthcare that we see today. Right? So healthcare typically consists of three different areas: payers, providers and patients. Today when you look at patients, there are a lot of innovation that's happening. It might be because of the push that is being given to the ecosystem by COVID, right? And a lot of demand has come from the patient innovation perspective, where a lot of startups have evolved trying to connect patient with providers and other ecosystems. Right? All these startups are focused more on patient experience in patients. Now the second space is providers. Right? How do we include doctors as part of this technology revolution? Right? What are the tools required for doctors? So that's where a certain number of startups have also started creating a lot of innovative tools, connecting doctors and patients using technology. Now the third piece, which is very important in healthcare ecosystem, is payers. Right? Now the payers can be insurers or even government. Right? And today we all understand in total healthcare delivery, almost 70% of it comes from primary healthcare, also called as OPD, outpatient department. Right? In spite of that, how much of this OPD expense is being covered by insurers today? That's hardly anything. Why is it so? Right? Why? Because today there are a set of challenges which kind of a showstopper for any payer to include OPD as part of healthcare coverage. Because of which today we see 70% of the spend that comes even from the insurer covered health policies is out of pocket. Right? It's all out of pocket expense that is coming and that is driving the whole healthcare economy in the country. And every year, you not believe, almost some 2.2 crores of populations are falling below poverty line just because of the out of pocket OPD expense. So that is a space which requires technology adoption. A lot of innovations has to happen in that space of healthcare financing in OPD. Today when you look at any healthcare policies, generally all healthcare policies cover hospitalization expenses. Probably you might also have heard of pre-hospitalization and post-hospitalization OPD, right? But how many times you must have heard of covering OPD as a standalone without the requirement of hospitalization? Can I go to a doctor, take a consultation and walk out with OPD coverage? Right? Today, the percentage that is covered as a standalone is very limited, right? In spite of the fact that 70% of the total healthcare delivery comes from OPD, the amount of OPD covered by insurers today is heavily limited. Right? Why is it so? Because of primarily two challenges. One, insurers today have only a network of hospitals. They don't have a network of OPD. Right? Because there is no network in place, as an insured, I go out of the network, pay out of my pocket and then apply for reimbursement. Now when we talk of reimbursements, we all understand it's a pain and time taking process for patient as well as payer. Right. As a payer, it's super expensive. Let me give you a fact. Last financial year, almost some 33 million healthcare claims are processed by payers at a cost of almost $20 each. That's the cost to process each claim using the existing infrastructure. Why is it so? Because the existing infrastructure is fundamentally built to process hospitalization claims, not a low ticket OPD claims. That is where the technology adoption has to come, right? So if I have to summarize, so today OPD is not being covered by any insurers because of two challenges. One, lack of access to OPD network, and two, lack of technology to process cashless claims in real time. When you look at insurer's angle, right, for any insurer to cover OPD, so what do I look at? One, what is my cost to process OPD today? Right? Can I use my existing infrastructure to process OPD? Right? That's just not possible, right? Because if you look at OPD as a standalone claim, it can be as small as 100 rupees, right? And average cost to process each claim today is around $20. So unit economics fails to process OPD as a standalone for any insurer in the country. So that's a key challenge. I need to address that first. And the second, abuse in the system. Right. The moment as an insurer I try covering OPD, the next thing that comes to my mind is how do I control the utilization? Right? Can someone abuse the system? Can there be overutilization? So which means again there has to be a technology which gives me controls wherein which I can operate OPD and monitor efficiently. Right. So these are fundamental challenges. I need access to the network, I need technology to process cashless claims in real time. Reimbursements in OPD just don't work. We started Medpay during the pandemic back in April 2020. I met my co-founder and CTO Arun Bhatia during our accelerator program run by Entrepreneur Fest. So Entrepreneur First has identified the problem that we are solving and the kind of impact that can have in a country like India. And so since from the early days, they have encouraged us and even funded us and led our seed round of funding. Today, OPD is highly unorganized in the country. It's super fragmented. They don't talk to each other. Forget about talking to insurance companies. Because it is highly unorganized, they were never part of any insurance networks. Right? And again, this is connected to reimbursements. Because they are not part of cashless networks, insured populations spend out of pocket and then apply for reimbursement, which again leads to a high amount of cost to process that claim as a reimbursement claim. So what Medpay is trying to do is we are disrupting this space by building a large connected care network of primary healthcare centers pan-India. So as we are speaking today, we have access to more than 50,000 healthcare centers. All are connected digitally. We can use APIs to access any of this network. It's not just the access to the network. We also provide ability to process cashless claims across the network in real time. So these are the two value propositions which are required by any insurer in the country to operate and manage OPD effectively. So that's the way today we work closely with insurers and various other partners to offer our network as a service in terms of accessing the network plus also process cashless claims in real time. So today when you look at standalone OPDs, right, so these centers were never part of insurance network. So at Medpay, we are enabling these standalone doctor clinics, pharmacies and diagnostic centers to be part of cashless insurance networks. And with the way we are integrating with this network, by integrating with Medpay, suddenly they become accessible to insurance population, right? So yes, so today even a small vendor, small mom and pop pharmacy store is able to accept insurance payments using Medpay.